Next, we'll hear from Helen Carey. She will offer advice with regards to safe cleansing and beauty products for lupus patients. So come on up, Helen, and tell us about your treatment, yourself, and a bit about the art of camouflage.
Thank you.
Thank you.
Hello. Thank you so much for having me today. My name is Helen, and I have had my whole career in dermatology as a medical assistant. I've had the pleasure of working with three fabulous female doctors who've mentored me in good skincare and how to prevent and how to rejuvenate. And what I would like to talk to you today is how to help your fragile skin, your painful skin, your skin that you want to make look better with just a few simple things. I'm really glad Dr. Desai talked about DermaBlend, because that is probably and what I'm about to say are my own opinions of things that I have learned over time working with products, working with dermatology. DermaBlend is probably one of the better products for masking things. I like it as a concealer. It works well all over, and it comes in many colors, as well as there's a couple different textures as well. So what I like to suggest for patients when we're looking with, well, first, let me get a show of hands. How many people really have issues with facial skin? Let's talk about facial skin. Yeah, facial skin. It can be hard to get to mask things, to make your skin look like you're not flaring, look like there's not a rash there. Most of the time, I work closely with a dermatologist who's working on the medical side, and then I help patients understand how to use cosmetics to help enhance facial, the masking of the redness and rashes. So Dr. Norris, I work for a female dermatologist who has a subspecialty in contact dermatitis, which means things that lotions, creams, sunscreens, products that you use on your skin, you sometimes get rashes from. So what I would like to talk about is some products, and there's a few other products over the counter called Vanicream, Vanilite, that are pretty allergen free. So they have minimal preservatives, and sometimes when you're dealing with skin that's raw, broken, rashy, you put a cream on it and it starts to burn. So you can't really, you're kind of fighting a losing battle with, then you have to use more medication, and then you have to use more, product to cover, and so you end up not doing anything. And then you're not really, feeling good about your skin in terms of presenting it and managing your illness. So we like to focus on some minimal things. We can still suggest some rejuvenating products for patients, male and female, who want to, get some enhancing anti-aging going on. But we usually get started first on doing a good presentation and using products that aren't going to irritate. So we like to suggest just a minimal, a pH balanced wash, which is minimally foaming. So when you use a pH balanced wash, you're not stripping your skin of the natural oils. So usually after some cleansers that are really soapy and foamy, you get this really tight, dry feel to your skin. It feels clean, but it's also very tight, and it can sometimes be painful if you have an underlying disease process going on. So a pH balanced soap or bar soap, cleansing foam, something that is more pH balanced. And like I said, I work really closely with the Vanicream products and the AB Skincare, which was designed specifically for skin that has allergies to products. So then after that, you want to hydrate your skin, and hydration is what makes your skin continue with feeling supple and soft throughout the day. There are several over-the-counter brands that we recommend in our office. We recommend Cetaphil, CeraVe, Vanny Light, and a rosewater glycerin, and then as well the AB Skincare, which is a glycerin spritz as well. So these products are very low in preservatives, low in ingredients that cause irritation. So that's face, body for cleansing and hydration. So now when we want to talk about cosmetics, I like to suggest several things to kind of keep your presentation easy and looking good. The Dermablend is a nice concealer, so you use that initially to even up your skin tone. You can use it all over, or you can spot treat. And then another part of good skincare is protection, UV protection. So with lupus, you also have sunscreens that you want to put on your skin. Well, you're also now looking at another product that potentially is going to irritate your skin. So for females, I like to suggest, Dr. Desai pointed out as well, mineral-based products that have zinc and titanium in the pigment. So they are not dye-based. They are not, they're not liquid-based. They're not anything that's going to irritate or make you flare with your lupus on the face. Then going to the body, you also would try and find a pretty clean sunscreen, or use the protective clothing. That's a great idea. There's sometimes when you mention your dermatologist's name, when you find a sun protection online, they'll give you a discount for your products. I believe that's sometimes the case. Because they know that you've been sent there by someone who is, sending you specifically for a good sun protection product. And then the final piece to really getting some good protection on your face is wearing a lip balm that is pretty clean as well. There's very few. I think the Vanny Cream line also has a lip protectant that has adequate SPF. And then you basically can finish off the rest of your makeup, for females, with your mascara, your lipstick, eye powder, anything else that you do in your routine. You don't have to eliminate those things. We try and educate patients to use good products for the bigger surface areas of the skin. So that is my presentation. Any questions? Perfect.
We're gonna have
Thank you.
questions in a bit.